Sometimes it seems like we get sick overnight, but usually this isn't the case. Normally diseases start off running very slow and progress over time. Usually by the time we notice any effect, the disease is so far progressed that it can be very expensive to get it back into control. I want to explain a method of checking your health by looking at your nails in order to do preventative and pre-diagnostic examinations on yourself. This concept may seem silly or trivial to most, but I'm hoping that I can assure you that this is a very good practice and how much your nails can actually provide a window into your own body's functionality. I will make my case by explaining the shape of the nails, the color and shape of the lunula of the nail, and the color of the nail and the nail bed itself. I'll explain what is normal and what isn't normal. Healthcare is so expensive nowadays. Why not learn how to pick up a skill that may help prevent having mass medical bills later on in life? First, I'd like to explain the shape of the nails. The shape of your nail can be a very good indicator of health. If the shape of the nail is changed, it's usually changed due to the swelling or edema of the tissue underneath the nail, and it isn't actually changing the nail itself. There are a few different kinds of changes that can occur. There's clubbing of the nail, and that is where the nail becomes very swollen and the nail shape becomes convex and bubbles up at the top. Then there's spooning, and spooning is the exact opposite of clubbing. Spooning is when your nail is concave. One way to find out if your nail is concave is by putting a little drop of water on the nail, and if it stays put without falling off, that means that your nail is flattened out. And then there is a puffy nail fold. And a puffy nail fold is the skin around the outside of your nail. If this happens to be swollen and red, this can indicate some serious systemic diseases, including lupus, scleroderma, and Raynaud's. Next, I'd like to explain the color and the shape of the lunula. The lunula is usually what's the white crescent-shaped half circle at the base of all of your nails. They should be white, and while your nail isn't actually white, it's the nail bed itself that has that color and appearance. Now, the several color changes can happen to the lunula, which mean different health issues. An absent lunula can mean anemia, while a red one can mean thyroid problems or heart issues. A blue lunula can mean low blood oxygen. It can also be for a rare inherited illness called Wilson's disease. So the color of your lunula is very important. Next, I'd like to explain the texture of your nails. Now, the texture of your nails is very important. There's a lot of changes that happen through the years of our life. And just because the texture of your nail changes doesn't always mean that it is out of the ordinary. Some of the changes that can occur are vertical lines, horizontal lines, pitting of the nail, Bull's lines, which are horizontal indents, and these all mean different things. Pitting almost always means psoriasis. If you have pitting of the nail, you'll have little tiny indents all over your fingernails that are pitted inwards. If you have pitting of your fingernails, it's a very good idea to go see a doctor. Bull's lines are horizontal indents. Usually occurs because the nail growth has stopped at some point and then restarted. And Bull's lines are associated with rheumatoid arthritis, chemotherapy, and if you have those, it's also very important to see a medical physician to have them actually assessed. Now, vertical indented lines on your fingernails can be very benign, or they can mean something like arthritis. Depending on your age and how you take care of your nails would depend on the severity. If you're 14 years old and you've had good health and all of a sudden you have vertical lines, it probably means you're going to end up with arthritis or that you have it already. Knock that off. Then there are also half and half nails. Half and half nails, or Lindsay's nails, are very closely related to Terry's nails. But when you have half and half nails, which are half pale nail and half red, that's very indicative of renal failure. It is almost always seen in patients of renal failure. If you have this is another reason to go and see a doctor. There are also certain lines that can form on your nails that tend to be white. There are Mea's lines and Meeker lines. Mea's lines are white lines that tend to happen from arsenic poisoning or traumatic events. These lines will move with the nail because it has actually changed the nail itself, while Meeker lines are double-stranded white lines in your nail bed. Therefore, as your nail grows, those lines stay the same. This most often occurs when you have low albumin or low protein in your blood, and they usually go away once the protein level has come back. In conclusion, our health is important, and being able to be proactive and know what our health is important to us. With medical expenses and medical insurance on the rise, I feel that it is very important to be able to do some pre-diagnostic looks at yourself. I feel that the nails is one of the best ways to find out what's going on within your body. By being able to distinguish the different kinds of nail problems and be able to see and look at our nails ourselves, we will be able to, it should help us to live longer and spare us a lot of financial burden, because usually one of the very first signs of any disease is a change within the nail itself. It could happen 6 months before the onset of the serious illness occurs. So by knowing and understanding the lunula of the nail, the color of the nail and the nail bed itself, the shape of the nail, right. So by understanding the shape of your nails, the shape and color of the lunula of your nail, the texture of the nail itself, and the color of the nail in the nail bed, we will be well on our way to being able to preventatively and assertively take care of our own health. Thank you.